Today's topic is drugs used in criminal offences and drug de-addiction by Prithviraj Thorat. To topics: understanding criminal drug uses, drugs used for abuse, the role of pharmacological interventions, de-addiction, the types of pharmacological interventions, steps for drug de-addiction, and importance of education and prevention. Understanding criminal drug uses. Criminal drug usage refers to illicit use of drugs leading to various legal and social consequences. It is important to understand the underlying forces contributing to drug related crimes, such as addiction, economic circumstances, and peer influence. By addressing these factors, we can develop effective interventions to reduce criminal drug uses. Generally, these drugs have no color, smell, or taste and can be easily added to flavored drinks, juices, alcoholic beverages, sweets, or snacks without the victim's knowledge. The drug the drug person may be sedated, confused, incapacitated, weak, and unable to comprehend what is happening or to defend himself or herself. Drugs used for abuse. Flurazepam. It is benzodiazepine 10 times more potent than diazepam and nicknamed roofies, rose, or rope, etc. Flunitrazepam is legally marketed as tablet for use as hypnotic. Along with sedation, it causes muscle relaxation, motor incoordination, and blackouts at higher doses. The action starts in 30 minutes, peaks at 2 hours, and lasts for 8 to 12 hours. Ketamine. It is potent, tasteless, and odorless drug, available as clear liquid or as white powder, nicknamed cat valium or K-hole, etc. After oral ingestion, it acts in 20 to 30 minutes to induce hallucinations and dissociative unawareness state. Nausea, rise in BP, tachycardia also occurred. The action lasts for 2 hours, but altered mention may persist for up to 24 hours. Gamma hydroxy butyric acid. The rapidly acting CNS depressant has many nicknames, namely Easy Lay, Liquid Ace, Liquid Ecstasy, Scoop, etc. It is tasteless, odorless liquid which can be mixed with any drink or beverages. GHB induces amnesia in 15 to 30 minutes, followed by dose-dependent depressant effect lasting 3 to 6 hours. However, the person may remain dazed for a few more hours. Alcohol. Strong alcoholic drinks, example whiskey, rum, brandy, etc., are often used as vehicle to clandestinely administer one of the above drugs, whose effects are boosted by alcohol. The alcoholic drink may itself be used to facilitate the crime by luring and forcing the victim to overdrink and become vulnerable. Taken in empty stomach, the action starts in 10 minutes and peaks in 30 minutes. Overdose can cause blackouts. The role of pharmacological interventions, that is de-addiction. Pharmacological interventions play a crucial role in addressing criminal drug usage. They involve the use of medications to treat addiction, manage withdrawal symptoms, and reduce cravings. By treating specific neurotransmitter system in the brain, these interventions help the individual to overcome addiction and improve the chances of successful rehabilitation. De-addiction. De-addiction is the process of delivering the subject of his addiction and maintaining him/her in the addiction-free state. The problem of drug addiction and drug abuse is widespread in India. It is a major public health and socio-economic problem, to tackle which Government of India launched the National De-addiction Program in 1987 and modified it in 1992. A drug de-addiction, a National Drug Dependence Treatment Center (NDDTC) has been established at Ghaziabad, and 122 other drug de-addiction centers are running in various parts of the country. Types of pharmacological interventions. There are several types of pharmacological interventions used in drug rehabilitation. These include opioid agonist, antagonist, nicotine replacement therapy, and medications for alcohol dependence. Each intervention targets different substances and mechanisms, providing the tailored approaches to address specific addiction challenges. Steps for drug de-addiction. Counseling and motivation. This is required to prepare the subject to undergo de-addiction program. It is generally done on outpatient basis, and may require several sessions spread over many days. Detoxification. It refers to reading the addict's body of the drug, and is generally carried out on institutional basis after admitting the subject in a de-addiction center. Detoxification may be done by sudden stoppage of drug and allowing the subject to undergo withdrawal syndrome, which starts soon after depending on the nature, pharmacokinetics, and quality of the drug that was being consumed. It may be severe or even life-threatening. It is short-lasting. Intensive support measures, including fluids, sedatives, etc., may be required. Gradual decreasing dose of addicting drug to prevent appearance of withdrawal symptoms or keeping it mild, thereby weaning the addict from the drug over a long period of time. Substituting the addicting drug by another drug of same class. A slow and long-acting oral conager is generally preferred for substituting the rapidly acting or IV drug. Example, oral methadone is used to substitute IV heroin and morphine. Similarly, chlorodiazepoxide and diazepam are used to substitute alcohol and suppress its withdrawal syndrome. Maintenance of nutrition, hydration, and correction of nutritional deficiencies is very important during detoxification, especially in alcoholics. Replacement prevention and rehabilitation. Addiction, a chronic relapsing disorder. After detoxification, craving for the drug persists for a long time. The addicts have a high tendency to start using the drug again, particularly on environmental cues. A number of techniques, including medical, behavioral, and social, are employed to rehabilitate the addict in his/her family and society. The medical measures are directed to either blockade of positive reinforcement or to create aversion. Blockade of positive reinforcement. Addicts are continuously administered a drug that blocks the pleasurable reinforcing effects of addicting drug. Consequently, pleasurable effects are not felt on taking addicting drug, and addict loses interest in drug over time. The craving gradually subsides. Examples are use of naltrexone for opioid addiction and that of naltrexone as well as acamprosate for alcoholism. Acamprosate targets the brain reward system so that one does not experience a high from alcohol. A lack of positive reinforcement decreases the frequency and intensity of urge to drink. Reinforcement reduction can also be achieved by inducing a high degree of tolerance to addicting drug. An example is methadone maintenance therapy for opioid addiction, aversion therapy, or negative reinforcement. The use of disulfiram in abstain post-alcoholic is the best example of aversion therapy of addiction. Effectiveness of pharmacological interventions. Pharmacological interventions have demonstrated significant effectiveness in reducing criminal drug usage and facilitating drug rehabilitation. Studies have shown that these interventions can reduce relapse rates, improve treatment retention, and enhance overall outcomes. By combining pharmacological approaches with other therapeutic interventions, we can maximize the chances of successful recovery. Importance of education and prevention. Education and prevention play a vital role in reducing criminal drug usage. By raising awareness about the risk of drug abuse, promoting healthy coping mechanisms, and providing early intervention, we can prevent individuals from engaging in criminal drug activities. Furthermore, educating communities about the benefits of pharmacological interventions can reduce stigma and encourage access of effective drug rehabilitation. MCQ. Government of India launched National De-Addiction Program in 1987. A National Drug Dependence Treatment Center (NDDTC) has been established at Ghaziabad. Drugs used in abuse are all except diazepam. In alcohol de-addiction, which substitute drug is used? Diazepam. Ketamine takes 20 to 30 minutes to induce hallucinations.